Hi, I'm Kiran Krishnan, a research microbiologist, and I've been studying the human microbiome now for almost 15 years. I was a co-founder of Microbiome Labs, the preeminent microbiome therapeutics company. I've done a lot of research on the microbiome, published a dozen or more studies in peer-reviewed journals. I've also written chapters in reference textbooks regarding the microbiome and leaky gut. Especially, I've got global patents in my name, so I've spent a lot of time studying and understanding and teaching about the microbiome. One of the really exciting and most recent topics around the microbiome is the role of the microbiome in hormone balancing, especially as women reach perimenopause, menopause, and even postmenopause. There are some significant changes that occur in the microbiome, and those are really important to keep in mind because they impact overall health, including hormone balancing itself. So welcome to the Rebel Health Hormone Optimization class. And this presentation will be talking about the role of the gut microbiome in hormone balancing and overall health. So the human microbiome, when you look at hormone balancing, the human microbiome does play a critical role in hormone balancing through a number of mechanisms. Number one is the regulation of steroid hormones, right? So most of your sex hormones are considered steroid hormones. So these are estrogen, progesterone, testosterone, and so on. The gut microbiome influences the metabolism of these steroid hormones, like estrogen, and they can even produce the enzymes to deconjugate or conjugate these hormones in order to inactivate them or reactivate them as the hormones are dumped into the gut. Most of these steroid hormones have a recycling or an excretion method where after they go through the body, they bind to the different receptors that utilizes the hormone starts to get cleared from the body by going to the liver. The liver conjugates these hormones to inactivate them, and then the conjugated hormone gets dumped into the gut for excretion. Now, there are microbes in the gut that can control the level of excretion or reactivation of the hormone to end up back into circulation. So the microbiome plays a very important role here. The microbiome can also influence the production of some of these steroid hormones by affecting the immune system. Now, most people have heard that the microbiome is in control of the immune system. You've got somewhere around 75% of your immune tissue in your gut, which means the gut microbiome is interacting quite heavily with your immune system. If you have a dysfunctional gut microbiome, you tend to have an inflammatory immune system. The inflammatory immune system sends signals to your, in the case of males, to the pituitary glands, eventually to the gonads. In the case of females, to the reproductive system to reduce the production of sex hormones, right? So the gut microbiome can play a very important role in the regulation and the production of these hormones. The microbiome also interacts with metabolic hormones, really important ones that become problematic in menopause. So these are hormones like GLP-1, ghrelin, PYY. These hormones affect how much you eat, your metabolic rate, the amount of fat you burn, the amount of fat you retain. The microbes in your gut play a very important role with upregulating these hormones and downregulating these hormones. This is part of the reason why, as you go into menopause, you will start to suffer with more weight gain over time, and it becomes harder and harder to maintain lean body mass because your metabolism can change as a result of the changing microbiome as you reach menopause and beyond. So the gut microbiome has a direct effect on the expression of GLP-1, PYY, ghrelin, the hunger hormone, leptin, the satiety hormone, all of that, and those can all be influenced by the diversity and the presence of keystone species. And we'll touch on that as we go along. The gut brain axis plays a very important role. The gut brain axis modulates stress response, anxiety, fight or flight response, and so on. And the gut plays a very important role with how your body deals with stress. Stress has a huge impact on your hormones and, again, your gut, which then again has an impact on your stress. So remember the cyclical thing that I talked about that occurs in the gut brain axis as well. If you have a microbiome that is low in diversity and high in pathogen load, you tend to be much more, you tend to have a much higher propensity for activation of the HPA axis and having neuroinflammation. So inflammation in the vagus nerve, which is a neurological system that connects the gut to the brain, and then activation of neurological systems to create a stress response, right? And then heightened stress response actually makes your gut even more leaky and inflamed. That can have a direct impact on hormones. So this is another feature of increasing brain fog, anxiety, depression as you start to reach into menopause. Hormone changes on its own can affect the gut. Gut changes can affect the gut-brain axis. So this is a very important finding. We know that higher cortisol levels as a result of HPA activation disrupts things like progesterone production. And can alter estrogen progesterone balance, which can then put people into estrogen dominance. So this is a very important topic that we'll address as we go along. We also know that there's modulation of the sex hormones, not just in the way I talked about in the first bullet point, but changes in the microbiome composition have been linked to variations in testosterone production. For example, in men, we have record low levels of testosterone production, even in young virile men who are at the age where they can impregnate people. These men are seeing a tremendous reduction in average testosterone value compared to men of the same age a few decades ago. Part of that is because of an increased load of pathogens, increased intestinal permeability, increased chronic low-grade inflammation, which has a feedback loop to reduce the amount of testosterone being produced. So this is called the gelding principle. The same thing can happen in women as well. In women, drops in Bacteroides and Clostridioides, which are two groups of bacteria, can specifically drive a reduction in estradiol. And a reduction in estradiol can lead to an increase in cortisol and an increase in anxiety and depressive mood and depressive behavior. So there's a clear connection there between changes in the microbiome and the resulting effect on hormones. So when you're looking at a microbiome test, right, and assume you've been able to go to a practitioner or look online for a gut microbiome test, I do want to point out a few things that you should be considering and thinking about when you're looking at a gut microbiome test. So the first thing is diversity, right? And most tests will call this alpha diversity. Alpha diversity basically means the number of viable species in your gut microbiome, right? And the higher, the better. Right. Most of the tests, and this result actually comes from an actual test I did on somebody that's dealing with perimenopausal estrogen dominance. But her diversity is okay. In this case, it's right around high average, which is around 200 or so species, 206 species more specifically, but you want to increase the diversity as high as you can. And I'll talk about at the end some strategies of increasing diversity. But keep in mind, gut microbiome diversity is one of the most important things you can do to manage menopausal symptoms, hormone balances, metabolic issues, and stress and mood issues as you're entering and going through menopause with regards to the gut microbiome. Right? So diversity, it impacts conditions like estrogen balance, PMS, PCOS, and estrogen dominance. In men, it affects testosterone and hypogonadism, which is that low testosterone issue, and it can increase androgen in women that can create mood issues and mood swings, and then PCOS and insulin resistance as well. So part of the reason why there's an increased risk for heart disease and type 2 diabetes in women after menopause or during menopause is because of the shrinking of diversity of the gut microbiome that occurs in menopause. It's important for me to note here that one of the factors that occurs when your hormones start to change, when you produce less estrogen, less progesterone, that in itself actually affects the diversity of your microbiome. So it's normal for the diversity to start shrinking as you're going through perimenopause and then further shrink as you're entering menopause. But the shrinking creates susceptibility to lots of issues. So as you're going through perimenopause, or if you're battling menopause already, a very important factor is increasing the diversity of the microbiome. And on the last slide, I'll give you some options of what to do to try to increase the diversity of your microbiome. Thyroid hormone levels are heavily impacted by loss of diversity in the microbiome. There's an impaired conversion of T4, which is the inactive form, to the T3, the active form, which can lead to hypogonadism, hypothyroidism. Hypothyroidism then has impact on metabolism and so on. Growth hormone levels can also be impaired, which then can cause insulin resistance, obesity, loss of lean muscle mass, changes in body composition, and so on, that a lot of people suffer from. And then the cortisol, the increased cortisol levels that's associated with low diversity, also can create anxiety, depression, mood disorders, and brain fog and inflammation in the neurological system. So cognitive function, memory, recall issues, all of these things are associated with the reduction in alpha diversity. There's a pathogen component within your microbiome. As your alpha diversity reduces, the growth of pathogens can increase quite dramatically as well. And when pathogens go up, you start to see an increase in inflammation, which then makes you more susceptible to lots of other chronic conditions like heart disease and so on. The presence of pathogenic bacteria, or as we call it, a high pathobiome, impacts hormone balance even further. For example, in estrogen balance, right, you've got elevated Klebsiella, which is a type or group of pathogens or a genus within the gut microbiome, or Proteus, or E. coli, or Clostridia. These can drive higher functionality of glucuronidase, which is an enzyme that then reactivates estrogen, creating a condition of estrogen dominance. This can create all kinds of irregularities in periods, mood swings, acne, and as you're going into menopause, it can effectuate things like risk for breast cancer issues and so on. So you want to be very cognizant of your pathogen load and maintaining a high diversity of commensal microbes, because they will help control some of the pathogens. The pathogens can also lead to leaky gut. Leaky gut leads to chronic low-grade inflammation. Chronic low-grade inflammation increases your susceptibility to lots of different conditions, right? So that is something to be cautious of as well. We see a ratio, and many tests will give you this Prevotella Bacteroides ratio. What you really want to do is have a higher Prevotella to Bacteroides ratio. People with low diversity and high pathogen loads tends to have a low Prevotella to Bacteroides ratio. A high Prevotella Bacteroides ratio, which is favorable, indicates a favorable metabolic profile in individuals, meaning they have low inflammation, they burn fat well, they can build lean muscle, they have a low propensity for type 2 diabetes, and so on. And often a higher fiber diet can enhance the Prevotella to Bacteroides ratio. If you have a low Prevotella Bacteroides ratio, you have an enhanced risk of metabolic disease as a component of going into menopause. So you want to increase your fiber intake. You want to try to maintain diversity. And again, I'll give you a number of things that you can try to do to increase and maintain high diversity. But fiber is going to be one of those things. And when Prevotella is too high, which you can of course have too much of a good thing, it can indicate a source of chronic low-grade inflammation and impact cortisol and insulin response. But just keep in mind, you want to increase diversity, keep the pathogens low, have a higher Prevotella to Bacteroides ratio. Keystone species. Keystone species are organisms within your gut microbiome that are so important to the structure and stability of the microbiome and to the stability of the structural elements in the gut lining. The keystone species are the organisms that maintain a healthy gut lining and prevent leaky gut. Leaky gut is where your intestines become very permeable, toxins, bacterial components, and all that leak through into circulation, generating a lot of chronic low-grade inflammation. That chronic low-grade inflammation dramatically increases the risk for chronic disease. So it's really important to understand your keystone species levels. There's about 10 or 12 well-established keystone bacteria. The only way to really know whether or not you have adequate keystones is to get a microbiome test. In the absence of a microbiome test, you want to just take actions that feed the keystone bacteria. One of those actions is the use of prebiotics, oligosaccharide prebiotics. They're often abbreviated as FOS, fructooligosaccharides, or GOS, galacto-oligosaccharides, or XOS, xylo-oligosaccharides. If you search for products with oligosaccharides as FOS, GOS, or XOS, you'll find products that have it that will feed these keystone species. Now, these keystone species make short chain fatty acids. The short chain fatty acids that they make from digesting fiber are very important for your overall metabolic health. They control the GLP-1 receptor and activate it. They improve fat burn, they improve metabolic profile, they increase lean muscle development, they improve satiety, and overall reduce inflammation. So these short chain fatty acids are absolutely critical for normal healthy function. And in women who are undergoing menopause, starting in perimenopause, you start to see a noticeable decline in short chain fatty acid production. So you want to increase short chain fatty acid production by increasing the keystone species and then feeding them a high fiber diet. Interaction to the gut-brain axis are also a key part of the keystone species. These keystone species can modulate inflammatory responses in the neurons. That reduces the fight-or-flight response and allows you, when you experience a stress, to come back down from that stressor and not be in an anxious state throughout the day. So you want to ensure that you have adequate amounts of keystone species for that. And then, of course, keystone species also maintain the diversity in your gut microbiome. So having low keystone species will lead to having low diversity in your gut microbiome. And we know, and we talked about in the previous slide, all of the impacts that low diversity can have. So you need to have keystone species in order to maintain diversity in your gut microbiome. And ultimately, reproductive health, so sex hormones that control vaginal dryness, for example, libido, those things are all impacted by the presence of keystone species. You can end up with low libido, vaginal dryness, painful intercourse all throughout menopause as a side effect of having low keystone species. So you want to maintain adequate keystone species, adequate diversity, so that you have a comprehensive look at sexual health as well. Estrobolome, I'd mentioned estrobolome not in that term, but the conjugation, deconjugation of estrogen. So estrobolome is a constellation of microbes in your gut that can control the recycling of estrogen in your gut, right? So estrobolome, if it's functioning, it can reactivate estrogen and then increase the amount of estrogen in your body. As you're going through perimenopause, many women may want to increase estrobolome functionality and increase the amount of estrogen that's being recycled into their system because you're not producing enough estrogen, right? So high estrobolome function, and estrobolome, remember, is a group of microbes. High estrobolome function, the benefit of that is maintaining healthy circulating estrogen levels. Right now, the drawback of that, if you're not in menopause, is you could end up with estrogen dominance. But a lot of women who are in menopause aren't necessarily concerned about estrogen dominance. They want to maintain adequate estrogen levels. So in this case, you would want a higher estrobolome, right? And the way you get a higher estrobolome is to actually consume things like, let me get here, to increase healthy fats, right? So if you want to increase estrobolome levels in your body, you want to increase fermented foods, you want to increase healthy fats, so fish oils and olive oils, and you want to increase things like kefirs and yogurts and sauerkraut and so on. So these are the bacteria that will feed off of these nutrients and then produce more of the enzyme glucuronidase in order to increase estrobolome function. If you're concerned about estrogen dominance and you want to reduce estrobolome, what you would do is you would increase dietary fiber and reduce red meat consumption, right? And reduce the consumption of high fat foods. But given that most people watching this are likely dealing with menopause and postmenopausal symptoms, and you probably don't have estrogen dominance as an issue, you probably want to increase estrobolome function so you're recycling estrogen better. In that case, you want to increase fermented foods, increase healthy fats, and in the most extreme cases, some people can get hormone replacement therapy, of course, to improve estrogen cycling. But then your body still has to cycle it, so estrobolome still plays a role in that. Indole is a compound that's produced by the gut microbiome from tryptophan. Tryptophan is an amino acid that's used to produce serotonin and melatonin eventually, right? But some of your gut bacteria, instead of producing melatonin and serotonin, will actually produce indole. Indole has an impact on your overall system, on hormone balance, both immunologically and metabolically, and also your neuroendocrine system. So, for example, if you can produce more indole, you will increase GLP-1 activation. Indole can stimulate the release of GLP-1, which improves then your metabolic profile, reduces the risk of type 2 diabetes, and improves weight management, right? Indole production can come from an increase in diversity within your gut microbiome. It can impact the gut-brain axis as well. Indole and its derivatives have an impact on the HPA activation by the gut-brain axis. Chronic exposure can enhance anxiety-like behavior. So you want to have a balance with indole production. You don't want too much, right? Because that can lead to anxiety, but you don't want too little, because too little means you could impact your metabolic health in a negative way. So high levels of indole can upregulate stress, but too low levels of indole can have a metabolic dysfunction in individuals. So indole production, which is denoted by certain types of bacteria in your microbiome, can actually be beneficial or be negative depending on the level that it's being produced. In terms of immune, indole alters the expression of the Treg cell versus Th17 cell, driving this levels of inflammation. So too much indole can also have an influence on increased inflammation. So you want to make sure that if your body has a tendency to increase inflammation, you have a lot of allergies, food sensitivities, maybe you have an autoimmune condition, maybe you have a lot of anxiety and stress, you might actually have too much indole rather than not enough. And in this case, what you'd want to do is you'd actually want to reduce indole production. And one of the ways you can reduce that is by reducing foods that increase indole production. And some of the foods, or actually a really relevant strategy, is to increase foods that increase hydrogen sulfide and sulfate reduction. Those would be foods that are rich in sulfate, so things like mushrooms and leeks and cruciferous vegetables. Those things can actually battle the indole production and reduce it and increase sulfates. So one of the ways in which you modulate microbiome function is by altering components of your diet. So if you're dealing with a lot of inflammation, you're dealing with a lot of sensitivities, your immune dysregulation, you have a lot of stress and anxiety, you can increase sulfate-rich foods. And if you just Google sulfate-rich foods, you'll find lots of great foods: nuts, mushrooms, leeks, sauerkraut, things like that. And those can help balance out some of the indole production. Going to the sulfate-rich foods, now hydrogen sulfide in itself, which can be converted from sulfate-rich foods to create hydrogen sulfide, you'd want to know, number one, if you tend to have a very high level of hydrogen sulfide producing bacteria. If you do have a very high level of hydrogen sulfide producing bacteria, one of the ways of reducing it is by reducing those sulfate-rich foods, as opposed to indole, for example, right? Hydrogen sulfide by gut bacteria can stimulate the release of GLP-1. Again, it can have metabolic benefits and improve insulin sensitivity, but too much of it can also compromise the intestinal barrier. So this is why a gut microbiome test becomes important, because you want to be able to measure your gut's level of production of these things. You want to look at microbes that produce indole. What is the relative abundance of those microbes? If you tend to have high levels of microbes that produce indole, you may have to adjust your diet to bring them down. If you have high levels of microbes that produce hydrogen sulfide, then you might want to adjust your diet by reducing sulfate-rich foods to bring their level down, right? So you can play around with this through your diet to understand what kind of diet really supports your gut microbiome, but ultimately you would need a good microbiome test to do that. You'd want to look at a whole genome sequencing test, not a 16S test. So if you Google complete whole genome 16S microbiome, whole genome microbiome tests, you'll find a number of options out there. Get the test done. It's a test you do at home. You do stool sampling, send it in. You'll get the results back, and you'll be able to understand some of these things a little bit better as a result of that. So let me give you a quick summation, right? Alpha diversity, probably the most important thing. It impacts numerous conditions in menopause, perimenopause, and generally hormone balancing. It can impact androgen levels in women, insulin sensitivity, testosterone production in men, estrogen balance, of course, metabolic health, anxiety, depression, and so on. Cortisol levels, all of those things are impacted by gut diversity, and then leaky gut, which is also impacted by gut diversity, and then the resulting chronic disease risk that comes along with having elevated leaky gut as a result of low diversity. Pathogens, you want to make sure your pathogen control is low, and or your pathogen levels is low, so your control is good, and diversity controls a pathogen. So always working towards diversity. Keystone species, as I mentioned, critically important. You want to elevate keystone species. Estrobolome, you want to adjust it based on whether or not you're estrogen dominant or not, like we talked about. And then indole and hydrogen sulfide are balancing acts that you need to do on your microbiome as well, that you can do through diet alterations of increasing protein or decreasing protein and increasing sulfate-rich foods. So let's talk for a moment in the last few minutes about increasing diversity on your gut microbiome. So here are some tips that you can do. Number one, you want to increase the diversity of your diet. The more diverse your diet is, the more diverse your gut microbiome is going to be, especially when we're talking about areas of plant-based foods, right? Because most of the microbes in your microbiome want to consume some sort of carbohydrate from plant-based foods. So diversifying fruits, vegetables, berries, nuts, other plant-based materials is going to be a huge positive impact on your microbiome. One of the tips that I give people all the time is to add in one new food a week, a plant-based food a week, and you can add in a nice lean protein as well. That's fine. Meat is not a bad thing for you, but you want to increase plant-based foods in order to help the microbiome. The other thing you want to do is manage stress. Stress increases the destruction of the beneficial bacteria within your microbiome. So you want to manage stress. You want to find ways of grounding yourself, of reducing cortisol response, of breathing deeply, doing diaphragmatic breathing, box breathing, whatever it takes to reduce your anxiety. And you especially want to do that while you eat or before you eat. Right, meal hygiene becomes really important. Right, you're going to increase your diet, the diversity of your diet. You're going to try to feed your microbiome, but before you sit down and eat, you absolutely want to sit down, calm down, sit at a given table, not be watching something stressful, not be doing 15 other things, not be eating on the go, because you don't want your HPA axis or your flight or fight response increased while you're eating. Because when you're eating, you want your parasympathetic system activated, which is the rest and digest system. If not, you're going to have your sympathetic system activated, which is the fight or flight response. And that's going to inhibit your ability to digest the food. So sit down, allow the meal, the smell of the meal, the taste, the color, all of that visual stimulation to increase salivation, gastric juice secretion. Take deep breaths, listen to some music that may calm you, and chew slowly and eat slowly in a calm, relaxed state. Right? That in itself will dramatically help your diversity. Exercise, so weightlifting. When you contract your muscles against resistance, it releases a set of chemicals called myokines. Myokines can go and actually increase the diversity of the gut microbiome and seal up the lining of the gut and reduce inflammation. They will increase keystone species and they will improve your overall gut health. Then, of course, all the de-stressing effect and the metabolic benefits of weightlifting. So do not be afraid to pick up weights. You don't have to be a musclehead at the gym. Just get a kettlebell, get some resistance bands, and just work your muscles against resistance 2 to 3 times a week. It doesn't have to be for much more than 10 to 15 minutes. Just take a muscle or two to failure, and that should do it, right? So that's another trick of improving diversity and your gut microbiome. Getting outside in the natural environment, just engaging with nature, walks, sitting down, eating in nature, that increases your gut microbiome diversity as well, and getting a dog. Studies show that households with dogs have people with lower incidence rates of viral infections, allergies, asthma, and it can increase the diversity of your microbiome. So if you want to adopt a dog, you've been thinking about it, this may be a good time to do that, right? So those things can be done and collectively to dramatically increase your gut microbiome diversity. And with regards to the keystone species, all those things I talked about will help the keystone species. But in addition to that, add in some oligosaccharide prebiotics, right? Remember, FOS, XOS, GOS, those are all oligosaccharide prebiotics that you can take as a supplement. You want somewhere around 1.5 to 2 grams. Inulin is another one you can use as well. Those will go a long way to increasing the growth of your keystone bacteria. Now, lots of the physiological changes and the downsides of entering menopause occurs as a result of changes to the microbiome because of the hormone imbalances. And then the changes in the microbiome further enhances hormone imbalances, and it is a cyclical problem. So you have to intervene and improve the state of your microbiome. So hopefully you gained some tips here. It was my pleasure to be able to talk to you about this. I'm again Kiran Krishnan. I'm a research microbiologist. You can reach me on social media if you want to listen to more of what I do. My Instagram handle is Kiran Biome. I'm also on Facebook as Kiran Biome, Kiran Krishnan. So thank you so much for your attention and appreciate your time.